If you are suffering with fibroids and you're interested in fertility, the first myth is that you may not hear anything other than the surgical options, which are typically called myomectomy, surgically cutting out some of the fibroids and then sewing the uterus back together. But if you've been told of only the surgical options, you need to know that there is a very good non-surgical option called uterine fibroid embolization, or UFE. UFE is completely non-surgical and outpatient. Our patients come into the center in the morning. The procedure takes me about 30 to 40 minutes. They're discharged the same day with a Band-Aid. It treats every single fibroid in the uterus, whether you have 1 or 100. And so likely, if you have the UFE procedure, it's the only procedure that you'll need for your fibroids. Another myth is that your gynecologist may tell you that if you have the UFE procedure, you can't have any children afterwards. And that's a myth. We've had numerous children born after UFE. I've had 3 sets of twins born after. The births are typically full term and vaginal. So patients can get pregnant and have gotten pregnant. In fact, the success rate is every bit as good as the surgical myomectomy, and some would argue better, because our patients tend to be older, and older patients have a lower fertility than younger patients. 60% of patients that have been interested in getting children afterwards have been able to after UFE. They may tell you you have too many fibroids or your fibroids are too big, that you wouldn't qualify for the UFE procedure. Again, another myth. It does not matter how big or how many fibroids you have in your uterus. What matters is you have symptoms, and if you have symptoms and you have fibroids that explain those symptoms, you're a candidate for fibroid embolization no matter what your gynecologist may tell you. Another myth your physician may tell you about fibroids is that if you have the UFE procedure, that you'll still undergo a hysterectomy anyway. And that's a complete myth. The vast majority of patients that undergo UFE will only have UFE, and that's it. It's a one-time procedure. There are occasional patients where the blood supply to the fibroids is not only from the uterine artery, but from the ovarian artery, and that will keep some of the fibroids alive, and we have embolized a rare patient a second time